Mr. Paul, sir, thank you so much for making time and coming on the What, Why, and How Can I podcast. Welcome.
Thank you.
You are a physical therapist. Physical therapist, and we were just talking a little bit. You're not a doctor.
I'm a doctor of physical therapy.
You're a doctor of physical therapy, but not a physician.
Correct.
So you do have your doctorate degree.
Yes.
Just real quick, some background. There was like a jump in physical therapy where you didn't need a doctorate degree to a certain year. Yeah. And then moving forward, you did. I don't know when that changed exactly.
I think that was like about 10 years ago. So I went from like a master's degree to a doctorate.
So you need a doctorate degree to become a physical therapist.
Yeah.
And do you know why that happened?
I was just kind of trying to advance our profession. There was more coursework involved, just like higher clinical reasoning skills, and just to...
Okay, clinical reasoning. Higher clinical reasoning skills. What are those? Why do you need them?
So as physical therapists, we mainly treat pain that's musculoskeletal, so like anything involved with muscles, nerves, and
soft tissue.
Yeah, soft tissue.
Okay.
And like, so we are trained to differentiate between a shoulder pain that is, your spleen or your heart or liver, things like that, versus just like a tendon or a nerve or something that's coming from your neck.
Oh, okay, so shoulder pain can be from a liver?
Yeah.
Get out of here. How?
Yeah, so we have pain that refers like to different areas.
Okay.
Like gallbladder as well. Wow. And so like we're trained that, to ask certain questions using, clinical reasoning, using what we understand about the human body to know when to refer out. Like, you need to go to emergency right now because you're having a heart attack, or hey, that's something you should check out with your physician. Set up an appointment, or we can continue treating today your shoulder for the pain that's coming from the shoulder. Okay.
So let's start with what is the concept of physical therapy? Because you do have your primary doctor, you do have your physician, probably the primary doctor or whatnot. Physical therapy, why does it differ and how does it specialize? You know what I'm saying?
Yeah. So we're primarily involved with anything related to pain or movement impairments, movement disorders. So we treat things from just your, low back pain, after a surgery, before a surgery. Physical therapy can be beneficial to kind of strengthen the surrounding muscles and structures, so that once you do end up going through a surgery that requires you to not put weight on, let's say, your leg, if you don't use it, you lose it. And so those muscles atrophy, and this way, like, there's less of that loss.
Okay, so you build up the muscle, have the surgery, and then when you do lose it, you're losing. You were at 150, so you go down to 100%.
Yeah,
for example.
Yeah, so kind of to expedite the recovery.
Okay.
We also work with like neurological conditions, like people with Parkinson's disease. Other like diseases that affect movement, that affect pain, and so like we kind of work on those impairments.
Okay.
With children with Down syndrome, cerebral palsy, things like that.
Okay, so, and I don't know if you can answer this, but sometimes somebody will get into like a severe accident, and the doctor's like, okay, you won't be able to move your leg, or you won't be able to walk. After physical therapy, and sometimes it takes months, sometimes years, they end up walking or moving their arm or moving their leg. What is actually happening there? Do we know?
So yes and no. There's definitely a level of uncertainty when we do treat, and we do have our knowledge base of the human body and like the different systems of the body, but at times we don't know until we try, in a sense that, you know, a person can have a diagnosis from their physician or neurologist, or that, you know, they're not going to be able to walk again. What we focus on is trying to retrain both the body, and whenever you're treating a body part, you're also treating the brain.
Okay.
And so the brain is kind of the...
I like how you put that. Okay.
Yeah.
Okay.
So like the brain is the command center, kind of like it tells the muscles, the nerves, you know, what to do. Okay. And even when, you know, it is beneficial, or when the body should feel pain and when it shouldn't.
Okay, that makes sense. You said when you're training the body, you're training the brain. I love that, dude. You should quote. You should coin that phrase right there.
I think I heard it like somebody else say it, but
because you can kind of use that pretty much in everything in life.
Yeah,
you know, when you, so that's interesting. Okay, so physical therapy. What is a typical day for a physical therapist? What is your schedule like? Does it differ every day, week to week? I mean, obviously there's probably different practices, like you work in a clinic, or you're remote, or you're traveling. How does it work for you?
So I work at an outpatient physical therapy clinic. So we get mainly referrals from primary care therapists. Although in California and a lot of states, we have what's called direct access, where you don't need a referral from your like physician to come see a therapist. Okay. Now, when you start getting into insurance, that's where
it gets dicey. Hey, we don't cover if it's not referred by your physician.
Yeah, and so like I believe it's within 30 days or so that I can still see you the first day, but then you need to get a referral within 30 days. Yeah, but you have clinics that they'll take cash pay, and sometimes it'll be less than what like insurance will like charge.
Okay.
So an outpatient clinic, usually patients are able to come by their own means. Although I've had a patient come in with in a wheelchair with her husband, or somebody come in with like an assisted device, like a walker or a cane. And what happens is first visits an evaluation, and different clinics, they'll operate differently in terms of like time and everything. But the first visit for us is 1 hour, and then follow-up visits are about 30 to 45 minutes. So it starts off with taking the patient's history, kind of what they come in for, and what I like to utilize, what I've learned from like other clinicians and just reading, is letting the patient talk, because you learn so much just by listening. And even today I had an evaluation where the patient was like, see, you actually listen. I feel like, which is like, it's not, you know, I'm not somebody like special, or it doesn't take much to
listen.
But what like researchers found is like patients get interrupted about, you know, the first 7 seconds of a conversation with their clinician, and yet if we let them talk, on average, they won't talk more than a few minutes, like to get everything that they want to say. And so it's, you know, I have like a template where, you know, I have things that I want to ask them, but like sometimes half that template gets filled just by listening to you know, what they're saying about their condition.
Yeah, that's cool. So how many patients do you see a day?
Right now, I started working at this clinic couple months ago, so I'm still building my caseload, but it'll be anywhere from like 8 to maybe 13, 14. And like we don't double book typically, so, you know, patients seen one, either physical therapist, myself, or another PT, or we have a physical therapy assistant as well that treats.
Okay, that's cool. What is... Okay, 2 questions. I'll ask the first one. What is the worst patient kind of you've had that you had to work with? In terms of injury, not like attitude or...
Yeah. Let's see. It's I think in... So at my current job, and this, to not break HIPAA.
Well,
like rules, but
follow your guidelines.
It's just there's severe accidents where person falls off a ladder or off a pole, and they have a bunch of screws in them, and my referral, or like I know in a sense, like from notes, what they're coming in for, and it's like knee pain, but they also have like a bunch of screws in their back. They fractured their shoulder, their head, face.
Oh man.
And so
it could be not the knee causing the pain, but the fact that they walking awkward or something.
Yeah. So, well, in this case, the referral was for the knee, but like, and I'm supposed to treat. This is where with insurance you have to kind of treat what is
they asked for.
Yeah, there. But I was also limited by, well, I can't do this movement because that aggravates or like hurts the back more, like pelvis or stuff like that.
Different areas.
Yeah, but I mean, I feel like I've seen quite a bit of variety, like where patient comes in, for neck pain, but they're also dealing with domestic abuse, and or patient is homeless, and and yet you still treat him like you would,
just like
anybody else. I've treated a patient who's transgender, and like whatever my views are on their lifestyle, I'm there to treat their pain and their movement.
Right. I mean, we're all human, so we try to help each other out.
Yeah.
Help each other survive. So you're a young physical therapist, and do you ever get any grief about that? Does a patient say, "Hey, Paul, dude, how old are you? Are you even gonna help me?" Have you gotten any grief about that?
Not too much. The mask kind of helps.
Yeah.
So we do wear masks as practicing the CDC guidelines. Right. But yeah, I mean, I've had patients ask me like how long I've been doing this, and I guess you just kind of try to embody confidence, and even when you're struggling, like I feel like I have a good support system with my coworkers, where like if there's a case or condition that I'm not used to as much, we bounce ideas off each other.
Okay.
But there's a little bit of trial and error, and ultimately do no harm to the patient, and I try to encourage them and give them hope, not false hope, but a lot of times patients come in and they've heard a bunch of different diagnoses, and that
from their friends off Google or something.
Yeah, or even clinicians where they're saying you have severe arthritis, you're out of alignment, you have weak hips, like I don't know how you're not in pain, like stuff like that. And so like that's one thing I try to focus on is not only using my hands but words to heal and to like help with the recovery.
Thanks. You're like a physical, spiritual, everything kind of healer, huh?
Yeah.
That's awesome.
Yeah, no, it's so much. Again, there's like psychology involved. There's you're working with people with emotions, with fears, with concerns. A lot of times I feel like pain puts us out of control because we stop moving because we're like, I don't want to make it worse. It's something that I can't see, like a scratch or a surface level. And so a lot of times we stop moving, things get stiff, things get weak, and I feel like I'm not there to fix you per se. I'm more to guide you to help you understand your pain experience, understand
help you help yourself pretty much.
I really like to utilize that approach where use your own body to heal your own body.
Okay, I like that. So why physical therapy? Why did you choose to go down this path knowing that you need a doctorate degree? Is that what you always wanted, or how did that kind of happen from a young age?
I think high school I started being interested just medicine in general. In our school at Oakmont, we had a health careers academy. I feel like that really kind of fueled my desire. Since high school, I was thinking like pre-med, go to medical school, become a physician, didn't want to spend 20 years of school. So I was like,
Yeah.
maybe a like family practitioner or like a pediatrician, which, you know, all the respect to them. And like we actually have a shortage right now of just general practitioners.
Really?
Yeah. But so I came into straight to UC Davis pre-med. Realized first couple of years that it wasn't really what I was passionate about. And so I was thinking, like, I know medicine is still something I'm really interested in. And I want to say one of my friends kind of suggested physical therapy. And so I just started taking a couple of internships, volunteering, and the more I volunteered, the more I was like, I can see myself doing this every day. And
dude, that is so wise right there. Yeah. One of the reasons this podcast exists is to help inform people of different types of careers. And then you did exactly, I think, probably the best thing was intern in a physical therapy and see if, like in your case, you fell in love with this. So obviously it helped you out. If you didn't fall in love with it, you would know, okay, well, I do something else.
40 hours, you know, instead of, you know, a lifetime of school.
Instead of 6 years in school and then realize that you don't like it.
Yeah. No, I hugely advocate, like, for younger people, like, volunteer or talk to somebody who already, you know, works at this job, so you can see what's a day like. You know, obviously, you know, there's good days and bad days, but like, as long as you can enjoy most of it and, you know, work through that.
Okay. And what's a good day? What's a bad day?
Let's see. So far, I've had pretty much good days for the most part.
Okay.
There are days where, like, patients don't show up, or you know, other days really busy. I feel like the clinic I'm at, there's really good work culture where you know, I don't feel like really burnt out. I know it's only a couple months in, but
you're still in your honeymoon phase.
Yeah, definitely. And so, but like, I feel like I can handle, you know, just back-to-back patients. You know, a lot in a row is just more the documentation that, like, you have to do at the end or stay after work a little bit. And,
So that's we had a couple nurses on, and that was the biggest complaint, was the charting. Let's talk about, so somebody maybe knows how horrible charting is in nursing. Let's talk a little bit all that, the office side of physical therapy and what you have to do.
It's a lot of just, you know, the time kind of commitment to it. And you know, sometimes you work through 10 patients, and, you know, so I think the challenge is trying to remember, wait, this is that patient, or, you know, just making sure, like, you know, you're accurate and also detailed. So I know there's, I guess, in a sense, room for variability, or, you know, different clinicians will chart differently. Some will write a whole, you know, story and paragraph. Others will, you know, do a couple of notes, and ultimately, like, documenting, there's a couple of reasons that, you know, it's kind of necessary evil, where one, if you didn't document it, you didn't do it. So if a patient comes back and, you know, like, wants to either sue you or wants to, you know, like,
question for some reason.
Yeah, you have, this is what we did. So it's kind of like covering all bases, making sure you're, you know, you did what you intended to do, and, you know, like, being ethical. I feel like that comes as a rule, being in a health profession. But, you know, at the same time, the requirement for insurance to get reimbursed. So if they're like, what, you just, you know, rub their back for 30 minutes and you expect us to
to pay you?
Yeah. So like, that, you know, does that qualify as, you know, skilled intervention, or
okay.
Yeah.
So there's a lot of nuances, a lot of T's and I's that you have to dot and cross to satisfy documentation, satisfy the patient, satisfy insurance, satisfy getting paid. All that stuff. Wow, that's a lot. So what's kind of your style? Do you like to take notes after each patient, or do you do it at the end of the day? How do you like to do that? Or what's the best way of being organized there?
So, like, my clinic provided me with a laptop. Like, it's like on a smaller side, so it's not, you know, like, covering my face or the patient's.
Yeah.
But I like to have like a little table and just at least have a little game plan of, oh, these are the exercises or the stuff we did last time, and this is the plan for today. So for the evaluation, that's probably the most extensive documentation, because you're taking the full history, assessment, and you're reassessing every visit as well. But some days, like, it has to be more extensive or more, let's, see how we did compared to first visit. And so I usually have it out there, but I also have like a little notepad where I'll sometimes jot down a quick
note. Okay. Are you able to like voice record just so you can remember, or no? I
want to say I haven't seen like the other clinicians do it. I suppose you could do something like that, but then I feel like for me it wouldn't be as efficient as,
because you have to listen to it all over again.
Yeah, and so like I'll sometimes document as I'm watching them do the exercises, or I'll also finish up at the end.
Okay, so you do have like windows throughout the meeting your patient and all that stuff.
Yeah, and then if a patient cancels, that's like potentially documenting time that you end up doing.
Yeah. Okay, let's catch up from the previous patient or whatever. Okay, what's a good day like? What have you learned to love about your job so far?
I love when, like, I guess having experiences where patient kind of like sees like a revelation about like
an aha moment.
Yeah.
Okay.
When like I've had patients telling like, see, that gives me hope, or like I've had patients express that we're just looking for hope, where they've been to other providers and like they weren't able to get help, or they've been made to feel broken, that like there's even testimonies of women getting abortions because like their past like whichever like clinicians told them that they're so weak that they're like, I don't think I can handle birthing or giving birth to a baby.
Wow.
And so it's more I try to encourage, motivate, help them understand that pain isn't always correlated well with damage. And I feel like, to me, that was one of almost the biggest things I learned in PT school. And that was both in what they taught in school, also reading what current like top providers are practicing our understanding of pain. And that kind of opened up a Pandora's box of, well, if pain doesn't, like, just because it hurts more doesn't mean it's getting damaged more, and that means I can push them harder. But then the question is like, to what point?
Okay.
And so and so there is a level of uncertainty, and I've learned to be okay with that.
Okay.
Understand that I'm doing no harm to a patient, where finding, like, communicating with them constantly, like checking in, how are you feeling? How's the tissue responding? Stuff like that.
So sometimes physical pain could be like a mental, just a mental type of thing, or
so it's not in the sense that, like, I like to say, you're not making it up, or it's all in your head, but you're not crazy, or you're not making it up. Where our brain uses threat or uses pain as a threat mechanism.
Okay.
And so it's kind of like a car alarm, where if somebody like breaks in the window, ideally the alarm's going to go off.
Yeah.
But at the same time, you have a loud car drive by, or a loud noise, and the alarm goes off.
Okay.
And so
it's like a false alarm.
Yeah. And so, like, that's where it's open to interpretation, where you're trying to understand, is this something that is stemming from an actual tissue damage, or is this just kind of sensitivity or a potential threat? Okay.
That's interesting. Wow. For pain, do you prescribe medication, or would that be their physician? Or
so physical therapists in US, we don't prescribe any medication.
Okay.
If you're in the military, then they have, like, it's in their scope of practice to, I think, prescribe like ibuprofen, but you can kind of get that. So I don't know if like maybe like higher dosage, but in general, we prescribe movement exercises, showing, ways to keep moving.
Okay. I mean, that's cool that there's that option. I'm sure there's some people are just like, nah, I don't want to do anything. Just give me some pain pills. But, it's cool that there is that practice. Like, hey, we can try to work this out without drugging you or whatever. Yeah. So how can someone listening or watching, and they're listening to your story and like, that actually sounds really cool. How can they, one, expose themselves to a physical therapist, to an internship, to volunteer somewhere, and then what's the process that you went through, and what are some tips from you?
So the way I did it, at UC Davis, we had the internship and career center, and so you sign up for. There's like a variety of different internships that it was kind of like lottery based. I don't know what it is. Now 5 years out, but so like either going, if you're in school right now, seeing if there's a resource because they have contracts and connections to like different clinicians. So I went through just different physical therapy settings. So I was in the hospital, I was in a private clinic, our student health center.
What did you like best?
I like variety. Okay. So I feel like I did an internship during PT school at a skilled nursing facility in San Jose, and I really loved that experience. Outpatient, I feel like there's a lot I can do and a lot of ways I can help. At the same time, in the hospital, sometimes the patients who are a little more low level, where they're not you're just getting up and walking, but sometimes that simple intervention like does wonders for them. So it's like I feel like all the settings are valuable. There's different niche like physical therapies specializations, like pelvic health specialty. So for both men and women, like if people have pain in the pelvic region, or especially after giving birth, a lot of like muscles get torn or strained. Seeing a pelvic health specialist would benefit that.
Okay, so physical therapy, but there's physical therapists that specialize in
pelvic health.
Yeah. Any other like sorts of part of the bodies that there's specialists in? There's
hand therapists, and there are hand therapists that are occupational therapists, which is like a similar field, but they work more with, like, one of my classmates, because the school I went to did both occupational therapy and physical. They said, we work with things that occupy your day. So they'll work with activities of daily living. So like, let's say a person had a stroke and they're not able to move, half of their body.
They can't brush their teeth.
Yeah. And so the occupational therapist will more so work on kind of retraining those movements, and sometimes using adaptive devices, things like that.
Okay. So more like just directed to specific daily tasks. Okay, that makes sense. Occupational things that occupy your day. Yeah. Because honestly, I've always heard occupational. I was like, okay.
Yeah, there's occupational health, which that's more like your workers' comp. So like if you get hurt on a job, then you'll probably get sent there at a hospital. But occupational therapy, that's a different profession. Okay. And then there's also speech language pathologists. I feel like us three, we sometimes work together a lot, either in the hospital or like a skilled nursing facility. Okay. Where
that makes sense.
They work with speech impairments and
awesome.
Things like that.
That's awesome. What other kind of tips? I know we kind of didn't finish about the how can I. What other kind of tips would you give to students that are in school? Maybe like you mentioned some examples of what they can do, but like maybe classes that they could take, or how start, like you in high school, you had a beautiful opportunity with the health academy. Yeah. Not every high school obviously provides that, or allows or exposes students to those types of programs.
Yeah. I would say, so going back to volunteering, I feel like a lot of clinics or hospitals, it might be a little more challenging to get through all the paperwork. Right now with COVID, it might also be a bit more challenging, but we do have one volunteer that he comes once a week and he just kind of shadows. So it's, if people want to reach out to me, or, if there's like I work in Auburn, so it might be a bit of a drive, but if people want to...
Better than nothing.
Yeah. And so if, people see a local clinic and they want to see what physical therapists do, that's one way to kind of go there. In terms of classes, looking back, I would say major does not really matter as much. It's more the prerequisite courses. So like even amongst physical therapy schools, there'll be each school might have different requirements. But I would say, in college, take classes that you enjoy, and also, if you're thinking physical therapy, definitely you need your core classes, science, math, but also take things like psychology, music. I feel like having kind of a balance of both, more like the science and arts, it'll make you a more well-rounded clinician, and understanding that people do need facts and information, but also as people, we have emotions, and actually working on active listening, hearing the person out. So
using emotions, you might be able to heal them quicker or physically.
Just like validating people's experiences. Like your pain, your 10 out of 10 pain, that tells me something,
right?
Tells me how much it affects you. Like you might be not screaming right now, but like that, you're trying to tell me something with that. Okay. And so it's I feel like that can benefit both, like in a career and just being a kind human being, and hearing what people have to say before we make judgments. Right.
Okay. You mentioned music. Is there any certain music that you play in your office when you're or no music?
No, we play music. So like I'd say like across the charts, kind of like different genres. We have like physical therapy aids that help us out as well with like setting patients up on like different machines or taking them through a couple exercises. So like you just plug your phone in and kind of it's kind of free for all, as long as it doesn't have profanity or
right. Like, none of that WAP stuff. Dude, that was a crazy week last week.
I haven't even heard that. Well, I only see memes about it, like not the actual song.
Okay, well, hey, Paul, thank you so much for coming on. I definitely learned a lot about a physical therapist today, and definitely if you guys have questions, reach out to us or reach out directly to Paul. Can they reach out on IG?
Yeah.
What's your IG?
It's Pashka_Chiburashka.
Pashka Chiburashka. So those who don't understand, it's Paul_turtle.
Yeah, some kind of
just because it rhymes.
Literally, I was trying to avoid making an Instagram for the longest time, and then when I finally did, I'm like, let's make it something entertaining. So,
okay, that's awesome. That's cool. That's cool.
Yeah.
Well, you can find him there. Direct message him, or come through us, and we'll connect you guys. Again, thank you for sharing, and hopefully one day maybe we could do this again, and you can share some kind of stories and maybe some tips from learning from your experience, how we can help improve people's lives or whatever else.
Yeah, I feel like every day I'm learning something new, and that's what I love about it. That's like, it's constantly changing, constantly.
That's awesome.
Lots of opportunities.
That's awesome. Well, thank you.